We're going to first talk about locating veins on arms. The best way to get proficient at it really is just practicing on real people, so yourself, family members, a friend. So looking over everyone's arm composition is different, obviously. Finding veins, if they're flat and you're having a difficult time seeing them, you can always use a hot pack, or flicking the vein helps to plump it up. Just don't hurt your patient. And knowing the difference between tendons and veins is a big one too. Tendons are more firm and stiff, and sometimes can feel like a AC vein. That's like probably the most common spot where it's thought that it's a vein. But if you're unsure if it's a tendon or a vein, you can always rotate the wrist like this, and you'll see the tendon actually contract, unlike the vein would. So that's kind of a little trick. Just take your time, have all your stuff set out, open your equipment, have it all laid out and ready to go, because when you're holding an IV site and you don't have your tourniquet, your tegaderm ready and things like that, it can make it difficult when you only have two hands. Putting the tourniquet closer to the site you intend on attempting. So if you're going to try in the hand, you don't need the tourniquet all the way on your upper arm. Putting the tourniquet down below the elbow if you're looking in the hand, and then of course above the elbow if you're looking at more of an AC site. And using gravity to your benefit is really helpful. So dangling the arm as much as you can. And also, with that said, we discussed in this morning's class, even if some people, especially elderly people with arthritis, have a hard time bending their arm and like hyperflexing it super straight, but even just that little bit of a bend can change the curve of the vein in the arm too. So just kind of popping that elbow out, like if you push up on the elbow and tell the person, like, make sure your arm is really straight at the elbow, is helpful. So here's a picture of the anterior and posterior view of the veins in the hand, forearm. Not every single person's veins are in the exact same spot on every single arm, but this is just kind of a general idea. Some of the most common sites, obviously the AC everyone's familiar with. The cephalic vein, I feel like, is kind of underutilized. That's a really good big vein as well. And then obviously as you move distal away from, towards the hand, the veins get smaller, the lumen diameter and size, so those can be a little trickier. There's more valves in the veins in your hand too, and those can pose a problem if you hit them. Sometimes you can float the catheter past them, but sometimes not. Sometimes it'll blow the site. First, let's talk about choosing a site. I know there's some questions about that, what site is best. For the patient's benefit, if you're noticing, the patient has chest pain, shortness of breath, low oxygen, coughing, things like that, if the patient needs a chest CT with IV contrast, the IV has to be at least a 20 gauge size minimum, and it has to be in the AC. So if you cannot get a AC vein, that's just something to keep in the back of your mind. That's not like in the SMOs, obviously, or anything that we expect paramedics to know, but it's just helpful to the patient. If you don't see an AC site on a patient like that, getting an IV site to give them any medications or to have on the call is obviously best, but if the IV is not there, once they come into the ED, we do have to still start a second line in their AC if they need that test. Some patients will ask you, like, don't put it in my hand or don't put it in the bend of my arm. Really, whatever they're asking, if you can accommodate it and there's sites and you see a good place to go, then obviously try to accommodate the patient as best you can. The hand is always going to hurt more. There's obviously less meat. There's less fatty tissue there and everything, and the nerves are closer to the surface. So the hand will always hurt more, along with all the way around the wrist too. Some people prefer it in the hand. I'd rather have one in the AC if it were me. Those are also, they're bigger veins, so they hold up longer. An IV can stay in 7 days during the course of a patient's hospital stay, and then the site has to be changed. So the bigger the vein, the more chance that the IV site will hold up. Deep veins, you might not be able to see them visually very well, but you can feel them. Those might require just a little bit more of an angle when you are approaching the site. We're going to watch a couple of videos on that in just a second. Rolling veins. That hand is really scary, isn't it? You just want to reach in there and hold those veins tight. But this is typically more like elderly people have veins like this, right? Where they look like they're barely sitting underneath the skin on the top of their hands, like the picture. These you need to pull very taut and hold tight to keep the vein from rolling so that you're not just poking the vein and it's going every which way. Usually rolling veins are in more elderly people that have lost their skin elasticity and they have less collagen. Younger people that tell you that they have rolling veins, that it's typically not true. They might have had like a bad IV start in the past by another medical professional and they missed and said, oh, you have rolling veins, that's why I missed. But typically young people don't have veins like this, right? There's a couple of different like common mistakes I feel like I see people do and students that come through the ER. A lot of it has to do with just the technique of the angle approaching and then lowering a little bit to be able to slide the catheter into the lumen of the vein. So I would say one of the biggest things for mistake-wise, it's either too much of an angle or too little. And then once you get that flash, people either don't wait for the little compartment where you get the blood filling up. Like if they see blood coming down the cannula, they just immediately start to flick the catheter in. You have to wait for this to fill with blood. And then the other thing, besides the angle either being too high or too low, once you get the flash, a lot of people keep going with the needle and the catheter instead of flicking this off the needle, and then you've just punctured and gone all the way through the vein.